please give a nice, Carney round of applause to Miss Regan, head of nursing.
Good morning, Carney students. How are you today? My name is Mrs. Regan, and I work with Nurse Emily and Nurse Sue. Do you know who that is? We work well together as school nurses. Today we have a special day for you planned. Today is Child Health Day, and we're going to talk to you about the importance of health insurance and how your families can get the insurance with our help. It's called Health Access Kids. It's a program that was put together by the school department, the Board of Health with Dr. Weiss, the Community Health Center with Pam Kavanaugh and her staff. And what we'll do today is we have some guest speakers. We have Dr. Peter Durkin, our school superintendent, and Mayor Mitchell that will talk to you about the importance of health insurance and why you should all have it. Thank you.
So how are my Carney learners today? Good. Everybody's ready to start the week, ready to learn? Working on your hard reading stuff, yes? Okay, I was in a classroom the other day and I saw how everyone was comparing and contrasting different things. And comparing meaning when we look at two things together, and contrasting when we see when they're the same and when they're different, right? Yes. Okay, so today we're talking about what it means to be healthy and what it means to be unhealthy, how we compare those two things. And being healthy means taking good care of yourselves, making sure you have a good breakfast, whether here or at home, and making sure that you're dressed warmly or coolly enough so you don't get distracted during the day, and making sure you go to the doctor not only when you're sick, but also comparing when you're healthy. And that's what health insurance helps us do. It makes us realize that we not only go to the doctor when we're sick, or when we have a toothache, or when we have a stomach ache, or feeling feverish. We go to the doctor when we're feeling well, so the doctor can tell us what we need to do to keep staying well, right? Okay, and part of going to the doctor is having health insurance, which is about what today is a celebration. So today when you go home to moms and dads, I want you to tell them that you spoke to Miss Regan today, that you saw me today as your superintendent, and I'm going to introduce Mayor Mitchell in a few minutes. All about staying healthy and making sure that we get health insurance to go to the doctor when we're well, and to also go to the doctor when we unfortunately get sick, okay? All right, so now I'm going to introduce Mayor Mitchell, who's here to speak to us also about this great day.
All right, thank you, Dr. Durkin. So listen, you guys are probably as hungry as I am. You can smell the mozzarella sticks in there. They smell pretty good right now. Listen, today we're here to talk to you, and I'm not going to take much time up. I know you guys have lots of stuff to do. We're real busy. Start of the school year. I know you're all working hard, right? Yes, absolutely. Well, listen, you're working hard so you can learn, so you can fill your brains up well, so that you can move on to the next grade and be at your best, right? That's the goal, be at your best all the time, right? Yes. But being at your best, so as hard as you're working at school and doing your homework and paying attention, listening to your teachers, you can't be at your best if you're not healthy. You just can't. If you're overtired, or if you're eating the wrong thing, you're putting the wrong things in your body, food that's not very nutritious, not very good, or if you're not getting checkups to prevent really bad illnesses from taking hold, if you're not taking those steps, if you're not making those choices, then you're not going to be able to perform at your best. And it's not just performing at your best in school. There are lots of you who play sports, there are lots of you who have outside activities, there are lots of you we all like to run out and go outside and play, including me. You can't be at your best. You can't be at your strongest. We don't want all of you to be strong in every sense of the word if you're not healthy. So today is about more or less about making right choices. So all of you are old enough now to start thinking in these terms. You know, when it comes time to picking out food, when it comes time to snack, there are people who know much more about this stuff than I do. But what I will say is that you need to think about taking care of your bodies, making good choices, and you know what those choices are. It's not going into the cabinet picking out another bag of potato chips right after you just had some, right? That's something, I used to do that. We've all done that at some point, but we all know that that's probably not the best thing for you. So it's making those little choices along the way. It's getting out and exercising a little bit, putting your, shutting the TV off, or putting away the screen. There's a time for that stuff, but it's not all the time. So it's getting out, it's exercising, and it's also making sure that your families know about health insurance options. This is something you can do. We all need to go to the doctor every once in a while and make sure the machine's working, right? So let's keep that in mind. That's harder to do if you're not properly insured. So we're conveying all this stuff to you at your age because we believe that you guys are responsible enough to use this information properly and to take charge of your future. That's what it's about. That's what you do in school, in the classroom every day. That's what you do with your bodies as well. So listen, I hope you enjoy the program here today. I want you to thank the folks who are up here for putting this together. Karen Megan, Brenda Weiss, and the superintendent, Ms. Tretta, everybody who's worked hard, Mr. Grace, everybody who's worked hard to make this happen today. Listen up, soak it all in, and then let's act on those good choices, okay? Thanks, everybody.
Thank you very much. Before we go, I have a few presents for you. We're going to give you a piece of paper that you're going to take back to class, put in your backpack, and give home to Mom. It'll tell you how your parents can sign up for health insurance for you. But then also, we have a sticker that you can have. It's the same logo as up there that you can use. I have one right here. Everybody's getting one. But also, real exciting is we're going to give you a pencil. All different colors. We're going to walk around very quietly and give you your pencils, your sticker, and your paper. How's that sound? Great. Does anyone have any questions for me right now? Okay, what's your question? Yes, they'll let you pick your colors, okay? But you're going to pick them real quick. We can't be here all day. We get back to class and you're learning, okay? Okay, go ahead, young man. I can't hear you, son. Right, fruits is a good choice. If you're hungry, fruits, vegetables is a very good choice. You're right. Okay, one or two more questions. That's about it. Go ahead in the green shirt. That's a green shirt. That's yours. You forgot? Okay, we'll move on. The red shirt back there? Well, see, that wheel there was created because they have a blanket on it, and that means we've got you covered. We're trying to have every family in New Bedford have health insurance, so you can go to the doctors when you're feeling well, like the mayor had said, or when you're not feeling well, you get the care. That's why it's our logo. All right, one more question. Let's see. Yep, you're right there. In the blue shirt. I can't hear you, hon. No? All right, one more. Where's one more question? Can you talk loud so I can hear you? Go ahead. Well, there's really no bad food. There's better choices. And that's what we're going to teach you also through the school year. Your teachers, health teachers will help you with that. They'll teach you what's a better choice. There's no really bad food, but there's better choices. All right, so I guess we'll end the program now. Is anyone else? Dr. Durkin? Thank you very much. And just sit quietly so we can have you pick out your pencil colors, okay? Thank you very much for coming today.
Mayor, are we encouraging people to, encouraging kids to buy health insurance, I guess have their families buy health insurance is a great thing.
Yeah.
Have you detected that there's not a lot of folks in New Bedford? There's a big number of folks without health insurance?
Well, there's certainly a gap. I don't have the figures right at hand, but it is true that there is a significant segment of our population that still doesn't have health insurance. In Massachusetts, it's more or less a matter of signing up for it. After the healthcare reform in the state a few years ago, we have near universal health coverage, and so we want kids to kids in our schools to get the word out to their parents about their options. And frankly, for a big part of our population, that is maybe one of the primary means we get the message out to families. So this works here. And today's event was as much about making choices, making good choices as anything else. We have young kids here, but it's never too early to cultivate in them a sense of responsibility over their own bodies. So we want them to make good choices about nutrition, as well as exercise, as well as helping their families get health insurance, which is just a matter of conveying information from the school. So, events like these are a good way to further those goals.
I wouldn't say it's heavy-handed, but it seems aggressive. That's me. It seems aggressive.
Well, look, I mean, we want to have a healthier city. And a big part of the job is to disseminate information. We're not holding a gun to anybody's head and saying, no, you shouldn't eat potato chips, you shouldn't eat fried food. God knows I eat more than I should myself. But the point really is to give people the information they need to make good choices.